My name is Dr. Tom Catena. I'm the medical director of the Mother Mercy Hospital. I've been here for a period of 10 years now. This area here is called the Nuba Mountains. We are not in South Sudan. We're actually in the Republic of Sudan, in the southern portion, in rebel-held territory. For children, the biggest needs are the basic ones: access to food, access to immunizations, treatments for basic diseases, which are malaria, gastroenteritis, pneumonia, really the basic diseases that children have, the three biggest killers that we have here in Nuba Mountains. When the fighting started, this is back in June 2011, the few NGOs that were here all took off. They left Nuba Mountains and left us pretty much by ourselves to try to take care of the population here. Some have now trickled back now that the fighting has slowed down a bit. We want to not only focus on curative services, but focus more on preventive care also. And that's where our idea of the outreach program and MFH came into play. We discussed in collaboration how to set up an outreach program. And the idea was we would establish 6 clinics in the region. We started with 4, now we've expanded to 6. And these clinics would be sort of our tentacles out into the community. The way this works is that we're here as an island, as a hospital. These clinics really are out in the villages. They've got their pulse on the problems in the communities. So it's very important to have this aspect of our care out there. I think without this, I don't think we'd be as effective as we are. Here, the healthy mother is the cornerstone of the family. She's the one who's there with the children, doing the cooking, the cleaning, doing the educating of the children at home. So if the mother's sick or not well, all those things collapse, and the children suffer greatly because of that. So the villages here are very remote. There are no roads. There's absolutely no transportation. There's no ambulance service anywhere. So if a woman has any complication of pregnancy, she's pretty much on her own. God knows how many maternal deaths happen in the villages that we never hear about. We have many neonatal deaths where the babies are born dead. There's a problem, a complication with delivery. That we know for sure. The main reason is just access to health care. As part of the outreach program through Medicines for Humanity, we do some training of the TBAs, which are traditional birth attendants. And the idea is they can do antenatal care at the village level. They can identify mothers who are at risk. That mother can be brought to the hospital early, before deliver here in the hospital, where we have all the facilities we need to take care of those problems. That she doesn't try to deliver out in the village, where she'll have a bad outcome.
My name is Sabura Alan. I am a clinical officer working as a coordinator health outreach program. With support from Medicine for Humanity, we have been supplying and running health services in 6 different outreach clinics. We do consultation for children under 5. We do antenatal care services for pregnant mother until delivery, even post-delivery care. We aim to reach up to 90,000 children with immunization services.
A fundamental key to preventing maternal and child deaths here is community outreach. And the community health worker is an essential agent for influencing health behavior towards positive outcomes, as well as creating the linkage between the community and the healthcare services. The Medicines for Humanity project trains community health workers to strengthen their knowledge and skills so they can make the difference.
personal hygiene and sanitation, diarrheal diseases, how can we prevent diarrhea, how can we manage it, nutrition, how to prepare food at home, exclusive breastfeeding, the importance of antenatal care, the importance of immunization.
The 6 clinics that Medicines for Humanity has helped to reopen are now providing more than 90,000 critically needed health services per year. We've seen as much as a 42% reduction in key illnesses that cause childhood deaths. These are mostly malaria, diarrhea, and pneumonia. We've increased the number of pregnant women who receive prenatal and postnatal care by 60%. We've trained and supported 153 community health workers and 80 traditional birth attendants. And there's been a 51% increase in the number of mothers giving births in our 6 clinics. Simply put, if the support for Medicines for Humanity did not exist, I don't think we'd be able to continue with this program, and the outcome would be disastrous.
People will die, children will die, pregnant mothers will die, because there are no other ways we can get all these services in.
What I would say to anybody who's so far helped us through Medicines for Humanity is that your donation is well used. Outreach program is running very well. We have 6 clinics that are up and running. They're well stocked with drugs. The training of both community health volunteers and traditional birth attendants is ongoing and is going on very well. With your ongoing support, we will continue to save lives and reach for the end goal, a world where no child dies from preventable causes or lack of health services. Thank you for caring about children and their mothers. Thank you for believing we can all do more. Thank you for helping to make a difference. May God bless you all.